Very important question is, how do we identify the symptoms of bone tumors? So, I would say there are three very important symptoms. One is pain, one is the swelling, third is pathological fracture. I'll go through them one by one. Coming to the pain, pain is one of the first presenting symptoms in bone tumors. Whereas in soft tissue tumors, it may present later. Most of the soft tissue tumors are painless to begin with, and only once they infiltrate the critical structures like nerves or vessels or surrounding structures, they become painful. But we see the pain commonly in young physiological age group, in children growing after playing sports, after injury, in elderly due to arthritis. So what differentiates that the pain is something which has a red flag attached to it? Normally, if there is a pathological process undergoing in the body, it may be a tumor or it may be metabolic disorder, it may be infective etiology, whatever. If there is a pathology inside the bone, then the pain which is there is almost constant, and it is associated with night cries. I'll just go through what we mean by it. So, if the pain wakes you up at night from sleep, then it is something worrisome. We need to check out what is the cause behind it. It may not be just the simple pain, physiological pain. If it is relieved with rest but again reappears, or it is not relieved with rest, not relieved with your painkillers, then it is something which needs further evaluation. Many a times it may or may not be attributed or with a history of trauma. Many a times patients who have a bone tumor or bone cancer, they say that they had an injury. They were hit by a ball or by hit by a two-wheeler or cycle, and then this developed. But we have to understand that this is just a coincidence, that the history of injury is usually the first point from where the patient started noticing, because the bone was already getting weakened by the process inside, and that injury, that impact just drew the attention towards this pathology. So the first important symptom is pain, which needs detailed evaluation. The second is swelling. Like I said, the swelling may be painless or painful, and we have to understand that we may have multiple swellings in the body. That may be a normal process. It may be there since birth. For many people, they have multiple lipomas over the body or multiple nerve swellings. We call it multiple neurofibromas. What we need to be careful about is that, is there swelling which is increasing in size or it is same? So any progressive increase in the swelling needs evaluation. Or if a swelling which was quiescent for a long time, which was not growing and has suddenly started growing in size, then it needs evaluation. Probably many a times a patient may have a benign condition like multiple lipomas, and one of them undergo transformation into a cancer. So that part of the swelling starts increasing in size. Third and very important aspect, the symptom, is pathological fracture. What do we mean by it? A fracture means there is a break in the continuity of the bone. When there is an underlying process, a pathological process, a disease which weakens the bone tends to fracture very easily. Normally, bones do not fracture unless there is a significant trauma or injury. But if there is a episode like simple fall, or while standing had a fall and noticed fracture in the spine or in another part, then it needs the evaluation of the underlying process. Like here you can see, this is our thigh bone, and you see here there is a fracture, and this is our spine, and here you can see that this is our L5, L4 vertebra, this is L3 vertebra, which is collapsed, and you can see that some pathology is coming out. I want to emphasize that these symptoms of pain, swelling and pathological fracture not necessarily means there is a cancer inside. What we need to understand is that there is some pathological process that needs to be evaluated and to be ruled out. It very commonly, it may be an infection, which is much more common cause. It may be a metabolic bone disorder. It may be osteoporosis. It may be osteomalacia. It may be rickets in children that is causing all these changes. It may be due to some vitamin deficiency. But it is important that if you have any of these symptoms, it requires evaluation to find out the exact cause of the problem. Especially we have to talk about the elderly population, because many a times when they have this bone pain or back pain, everything is attributed to the physiological process of aging. But like I said, these symptoms are just a simple X-ray can show you that if the bone condition is weakened, there is a diffuse osteopenia, diffuse osteoporosis, or some part of our vertebral body is collapsed, or there is a constant pain not relieved, and associated with any symptoms like constitutional symptoms like you have fever, you have malaise, you have weight loss. So it needs a detailed evaluation. It may not be just a simple physiological degenerative spondylosis. Many a times we have found that there may be underlying multiple myeloma or metastasis which may cause these problems. What is important that we should not get panicked or worried if there is any symptom like this, because we know that the incidence of cancer is much less. Most of the times it is some another problem. It may be a metabolic disorder. It may be deficiency of vitamin D, which may be causing this pain. So, but it requires evaluation. It should not be ignored or neglected. Sometimes there are lesions in the skin and pigmentations, like this picture here, what you see. Many of us have got these nevus over our body. These are black discolored parts. It is important to understand that most of the time these are very symmetrical. But if you see that it is spreading and it is increasing in size and asymmetrical, then it requires evaluation that there might be changes of malignancy which is undergoing there. Similarly, we may have non-healing ulcer which may be there for a long time, especially in diabetes or something, or even because of any previous trauma. But if the ulcer is not healing, it is progressing, then we need to do a biopsy. Like here what you see, there is breakdown in the skin and there is some lesion all around. So you can just do a biopsy from different sides of the edges to rule out that there is no underlying pathology. A long-standing ulcer can also change into cancerous part, and it is called like squamous cell carcinoma, which is, or the Marjolin's ulcer in a pre-existing non-healing ulcer.